Outcome number 2 is consent to care and treatment, and it's looking for the practice to have systems in place to gain valid consent from patients to ensure that patients have an opportunity to be involved in their treatment planning and decision making, and to have opportunities to withdraw consent if they change their minds, and that the practice at all times respects the patient's rights throughout the process of consent and during treatment. A patient would experience a two-way communication process with the dentist in the surgery and an exploration of all the different options available to them. The General Dental Council have got an excellent document online called Principles of Consent, and everybody should be familiar with the content of this particular document. For those who are members of Dental Protection, and I'm sure this is true for other indemnity providers as well, there's an excellent series of risk management booklets online as well. So to prepare for this, a practice manager needs to ensure that team training takes place about consent, and that includes topics such as free will, autonomy, to ensure that team members have undertaken course CPD, which includes legal and ethical issues. They should ensure that if they do a records audit, the audit process shows that there are consent processes in place during the treatment planning stage. And finally, it's important that the whole team understands that consent is a two-way process and it's not a tick box exercise. Our practice management manual for CQC will help you reorganise your existing quality assurance practice systems in 3 steps. First of all, use the A3 checklist for this outcome from the back of the manual to audit your compliance. This gap analysis helps you to identify actions that will improve outcomes for people who use your services, in other words, your patients. Then use the agenda from the front half of this manual to conduct a training session for your team. It includes an attendance record, and a training pack is available from our website. Finally, show your team the results of your gap analysis for this outcome and discuss who will work on items marked amber, which you've identified that you have but may need updating, and who will action items that are marked red, which you have identified are outstanding pieces of work. Examples might include a business continuity plan. Once you've decided which audits are required to measure, monitor and modify your systems, you're ready to record your agreed action plan at the bottom of the agenda and to set a time frame for completion. For efficiency, I'd suggest you give each team member a manual so that they have a personalised individual training record and an action plan to work from. This way they can concentrate on recording and completing the tasks delegated to them and demonstrate their involvement to a CQC assessor. As a practice manager, your copy will be the master audit plan for the whole practice, as well as your master training record, helping you to ensure the practice meets the outcomes in section 4 of the CQC guidance, which is suitability of staffing.